Question 1. The investigation demonstrates that a medical practice has recently implemented a new electronic health record, AIR, and billing system. The medical coders and billers have received minimal training on the system's specific coding and billing functionalities, and there are no clear updated procedural guidelines provided for navigating the new software. Given this situation, which approach best ensures accurate claim submission and compliance with payer requirements while minimizing the risk of claim denials and regulatory violations? Option A. The medical coders and billers should proceed with submitting claims using their existing knowledge and the system's default settings, assuming the new system will automatically adapt to their previous coding practices. Option B. The medical coders and billers should wait for the system vendor to provide comprehensive training and updated guidelines, and in the interim, continue to use their old workflows as much as possible. Option C. The medical coders and billers should focus on submitting the highest volume of claims possible to maintain cash flow and address any coding or billing issues that arise after claims have been processed. Option D. The medical coders and billers should proactively seek out additional training resources, engage in thorough testing of the new system's coding and billing modules, and collaborate with the IT department and billing management to develop and validate updated procedural guidelines before submitting claims. Correct answer is D. The medical coders and billers should proactively seek out additional training resources, engage in thorough testing of the new system's coding and billing modules, and collaborate with the IT department and billing management to develop and validate updated procedural guidelines before submitting claims. Explanation. Scenario analysis. This scenario presents a common implementation challenge where a new billing system is introduced without adequate training or clear procedural guidelines for medical coders and billers. The challenge lies in ensuring accurate claim submission and compliance with payer requirements when staff are unfamiliar with the system's nuances and potential for misinterpretation of coding rules within the new interface. This can lead to claim denials, delayed reimbursement, and potential compliance issues if incorrect coding practices are inadvertently adopted. The professional challenge is to navigate this transition effectively while maintaining the integrity of billing processes and adhering to regulatory standards. Correct approach analysis. The correct approach emphasizes proactive education and validation. By conducting thorough training sessions that cover the specific functionalities of the new billing system and its impact on coding practices, and by implementing a robust quality assurance process to review initial claims, medical coders and billers can mitigate errors. This aligns with the CMCB emphasis on accurate coding and billing to ensure appropriate reimbursement and compliance with federal regulations such as the Health Insurance Portability and Accountability Act, HIPAA for data privacy and security, and the Centers for Medicare and Medicaid Services, CMS, guidelines for claim submission. This approach prioritizes understanding and verification, which are fundamental to professional competence and ethical practice in medical billing and coding. Incorrect approaches analysis. One incorrect approach involves relying solely on the system's default settings without understanding their implications for coding. This is a regulatory failure because it bypasses the coder's professional judgment and responsibility to apply correct coding principles according to established guidelines, e.g., IC 10cm, CPT. It can lead to inaccurate coding, which violates payer policies and potentially fraudulent billing practices. Another incorrect approach is to assume that all previous coding practices will translate directly to the new system without verification. This is an ethical and regulatory failure, as it ignores the possibility of system-specific logic or changes in how data is captured and interpreted. It can result in coding errors that lead to incorrect reimbursement and noncompliance with payer contracts and government regulations. A third incorrect approach is to delay seeking clarification on system functionalities or coding discrepancies until after claims have been submitted. This is a failure in professional responsibility and can lead to significant downstream problems, including claim rejections, appeals, and potential audits. It demonstrates a lack of proactive problem-solving and adherence to best practices for efficient and compliant revenue cycle management. Professional reasoning. Professionals in medical coding and billing must adopt a proactive and detail-oriented approach when implementing new systems. This involves a commitment to continuous learning, seeking out training, and actively validating processes. When faced with system changes, the decision-making process should involve 1. understanding the system's functionalities and how they interact with coding and billing processes. 2. Identifying potential areas of discrepancy or confusion. 3. Seeking clarification from system vendors, supervisors, or relevant professional resources. 4. Implementing a pilot or testing phase with rigorous quality assurance before full system rollout. 5. Prioritizing ongoing training and updates to ensure sustained compliance and accuracy. Question 2. Upon reviewing the medical record of a patient with hypertension, stable, type 2 diabetes mellitus, controlled with diet, and newly diagnosed osteoarthritis requiring a referral to a specialist, the physician's documentation details the review of the patient's current medications, analysis of recent lab results indicating controlled blood glucose, and the decision to refer the patient for further evaluation of the osteoarthritis. Which of the following best reflects the appropriate E/M coding consideration for the medical decision-making (MDM) in this scenario? Option A. The MDM is determined by the number of chronic conditions managed, regardless of their stability or the complexity of data reviewed. Option B. The MDM is primarily driven by the new diagnosis of osteoarthritis and the referral, with the stable hypertension and controlled diabetes contributing minimally to the overall complexity. Option C. The MDM is assessed by evaluating the number and complexity of problems addressed, the amount and complexity of data to be reviewed and analyzed, and the risk of complications and or morbidity or mortality of patient management. Option D. The MDM is solely based on the physician's decision to refer the patient to a specialist, with other patient conditions being irrelevant to the E/M level. The correct answer is B. The MDM is primarily driven by the new diagnosis of osteoarthritis and the referral, with the stable hypertension and controlled diabetes contributing minimally to the overall complexity. Explanation: this scenario presents a common challenge in medical coding: accurately documenting and coding evaluation and management (E/M) services based on the complexity of medical decision-making (MDM). Professional challenge lies in discerning the appropriate level of E/M service when a patient presents with multiple comorbidities, some of which are stable and others require active management. Coders must meticulously review the physician's documentation to identify the elements that contribute to the MDM, specifically the number and complexity of problems addressed, the amount and or complexity of data to be reviewed and analyzed, and the risk of complications and or morbidity or mortality of patient management. Failure to accurately capture the MDM can lead to undercoding or overcoding, impacting reimbursement and potentially leading to compliance issues. The correct approach involves a thorough analysis of the physician's documentation to determine the level of MDM based on the established E/M guidelines. This includes identifying each unique problem addressed by the physician, assessing whether each problem is stable, improving, worsening, or new, and then quantifying the number and complexity of problems. Furthermore, the coder must evaluate the amount and complexity of data to be reviewed and analyzed, such as reviewing prior records, ordering tests, or consulting with other physicians. Finally, the risk of complications, morbidity, or mortality associated with the patient's management must be assessed for each problem addressed. This systematic approach ensures that the E/M code accurately reflects the cognitive effort and risk undertaken by the physician, adhering to regulatory requirements for accurate reporting. An incorrect approach would be to assign an E/M level solely based on the number of diagnoses listed or the time spent with the patient, without a detailed assessment of the MDM components. For instance, simply counting stable chronic conditions as requiring new or active management would lead to overcoding. Conversely, overlooking the complexity of analyzing diagnostic test results or the potential risks associated with managing multiple interacting chronic conditions would result in undercoding. Another incorrect approach is to assume that any mention of a comorbidity automatically elevates the MDM level without assessing its current status, stable, worsening, etc., and the physician's active management of it. These failures violate the principles of accurate E/M coding as defined by regulatory bodies, leading to non-compliance. Professional decision-making in such situations requires a systematic review of the entire medical record, focusing on the physician's thought process and documented actions. Coders should be proficient in applying the E/M guidelines, understanding the nuances of each MDM component. When documentation is unclear or ambiguous, The professional practice is to query the physician for clarification rather than making assumptions. This ensures that the coding accurately reflects the services provided and maintains compliance with payer and regulatory requirements. Question 3. Benchmark analysis indicates that a provider documents a patient presenting with symptoms that strongly suggest a specific condition, and the clinical notes provide detailed information supporting this diagnosis. Yet the provider does not explicitly state the final diagnosis using the exact terminology found in the ICD-10-CM index. According to the ICD-10-CM official guidelines for coding and reporting, what is the most appropriate coding action? Option A. Assign an unspecified ICD-10-CM code for the symptoms, as the provider did not explicitly state the final diagnosis using the exact terminology. Option B. Assign the ICD-10-CM code for the implied condition, but add a modifier to indicate that the diagnosis was not explicitly stated by the provider. Option C. Assign the ICD-10-CM code for the implied condition if it is clearly documented and supported by the clinical evidence, and the guidelines permit coding to the highest level of specificity based on the documentation. Option D. Assign an ICD-10-CM code for a suspected condition based on the provider's clinical impression, even if not definitively stated. The correct answer is C. Assign the ICD-10-CM code for the implied condition if it is clearly documented and supported by the clinical evidence, and the guidelines permit coding to the highest level of specificity based on the documentation. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a provider documents a condition that is not explicitly listed in the ICD-10-CM official guidelines for coding and reporting, but is clearly implied by the clinical documentation. The professional challenge lies in accurately reflecting the patient's condition for reimbursement and statistical purposes while adhering strictly to coding guidelines. Coders must exercise careful judgment to determine if an implied condition can be coded, balancing the need for specificity with the limitations of the coding system and official guidance. Correct approach analysis. The correct approach involves reviewing the ICD-10-CM official guidelines for coding and reporting, specifically sections pertaining to the use of unspecified codes and the principle of coding to the highest level of specificity supported by documentation. If the guidelines permit coding an implied condition when it is clearly documented and affects patient care or management, then coding that implied condition is best professional practice. This ensures accurate representation of the patient's health status, which is crucial for appropriate reimbursement, quality reporting, and epidemiological data. Adhering to official guidelines demonstrates compliance with regulatory requirements and ethical coding standards. Incorrect approach is analysis. Coding an unspecified code when a more specific, implied condition is clearly documented and supported by the clinical record is an incorrect approach. This fails to meet the guideline of coding to the highest level of specificity, potentially leading to inaccurate data and under-reimbursement. It also misrepresents the patient's condition. Conversely, coding a condition that is merely suspected or not definitively documented by the provider, even if implied by symptoms, is also incorrect. This violates the principle that coders should not interpret or add diagnoses not established by the physician. Such an action could lead to fraudulent billing and misrepresentation of patient care. Another incorrect approach would be to refuse to code any implied condition, even when explicitly permitted by the ICD-10-CM guidelines, thereby failing to accurately capture the patient's full clinical picture and potentially impacting quality metrics and research. Professional reasoning. Professionals should approach such situations by first consulting the ICD-10-CM official guidelines for coding and reporting. If the guidelines are ambiguous regarding implied conditions, the next step is to query the provider for clarification and more specific documentation. This collaborative approach ensures that the code assigned accurately reflects the provider's clinical judgment and the patient's condition, while remaining compliant with all applicable coding rules and regulations. The decision-making process should prioritize accuracy, compliance, and ethical practice. Question 4. Examination of the data shows a physician's progress note documents dyspeptic symptoms for a patient presenting with heartburn and bloating. The coder needs to assign the appropriate ICD-10-CM code for billing. Option A. Assign a code for gastritis, as dyspeptic symptoms often indicate this condition. Option B. Assign a code for dyspepsia based on the physician's documentation. Option C. Assign a code for heartburn and bloating separately, as these are the symptoms documented. Option D. Query the physician to clarify the specific cause or nature of the dyspeptic symptoms. The correct answer is D. Query the physician to clarify the specific cause or nature of the dyspeptic symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a physician's documentation uses a term that is medically accurate but not the most specific or commonly used term for billing purposes. The challenge lies in accurately translating the physician's intent into a billable code while adhering to coding guidelines and payer requirements. Misinterpretation can lead to claim denials, underpayments, or even compliance issues. Correct approach analysis. The correct approach involves recognizing the physician's terminology, understanding its medical meaning, and then consulting authoritative coding resources to find the most specific and appropriate ICD-10-CM code. This ensures accurate representation of the patient's condition for billing and statistical purposes, aligning with the principles of accurate medical coding and compliance with the ICD-10-CM official guidelines for coding and reporting. This process upholds the integrity of medical records and billing, which is a core ethical and professional responsibility for medical coders. Incorrect approaches analysis. One incorrect approach involves simply coding the term as written without further investigation. This fails to meet the requirement for specificity in ICD-10-CM coding. If the documented term is a synonym or a less specific descriptor for a condition with a more precise code, this approach leads to inaccurate coding and potential claim rejection or audit findings, violates the principle of coding to the highest level of specificity. Another incorrect approach is to assume the physician meant a different, more common condition without confirmation. This is a significant ethical and professional failure. It involves making assumptions that can lead to misrepresentation of the patient's diagnosis, potentially impacting future care, research, and billing accuracy. This bypasses the necessary verification process and introduces a high risk of error. Third incorrect approach is to ignore the term and code based on other parts of the documentation that seem more straightforward. This is also problematic as it disregards potentially crucial diagnostic information provided by the physician. Even if the term is unusual, it was documented for a reason and must be addressed through proper coding research and clarification if necessary. Professional reasoning. Medical coders must adopt a systematic approach. First, understand the documented term. Second, research its medical meaning. Third, consult the ICD-10-CM code set and its official guidelines for the most accurate and specific code. If ambiguity persists, the professional practice is to query the physician for clarification. This ensures that the code accurately reflects the documented diagnosis and adheres to all regulatory requirements. Question 5. Performance analysis shows a coder consistently receives requests from a physician to add a diagnosis code for a condition that is mentioned in passing in the patient's chart, but not fully documented with supporting clinical indicators or treatment plans. The physician states this is to ensure all aspects of the patient's health are captured for billing purposes. What is the most appropriate course of action for the medical coder? Option A. Report the physician's request to a compliance officer without attempting to resolve it directly with the physician. Option B. Query the physician for clarification and additional documentation to support the requested diagnosis code, explaining the need for comprehensive clinical evidence. Option C. Code only the diagnoses that are clearly and thoroughly documented in the medical record, ignoring the physician's request. Option D. Add the diagnosis code, as requested by the physician, to ensure all relevant conditions are billed. The correct answer is B. Query the physician for clarification and additional documentation to support the requested diagnosis code, explaining the need for comprehensive clinical evidence. Explanation. This scenario presents a professional challenge due to the inherent conflict between a provider's request and the coder's responsibility to accurately reflect patient conditions based on documentation. The coder must navigate the ethical obligation to maintain coding integrity and compliance with payer guidelines, while also respecting the physician's clinical judgment. The challenge lies in ensuring that coding decisions are supported by objective documentation and do not misrepresent the patient's health status for financial gain or other improper purposes. The correct approach involves a thorough review of the medical record to ascertain if the documentation supports the physician's request to add a diagnosis. that is not explicitly stated or clearly implied by the existing notes. If the documentation is insufficient, the coder must ethically query the physician for clarification or additional documentation that substantiates the requested diagnosis. This upholds the principle of accurate coding, which is fundamental to the CMCB certification, and aligns with regulatory requirements for truthful and complete reporting of services and conditions. It ensures that reimbursement is based on actual patient care and diagnosis, preventing fraud and abuse. An incorrect approach would be to blindly add the diagnosis as requested without verifying supporting documentation. This action directly violates the principle of accurate coding and could lead to fraudulent billing practices, as it misrepresents the patient's condition. Such an action would contravene the CMCB ethical code and potentially violate federal regulations, e.g., False Claims Act, anti-kickback statute in the U.S. context, if applicable to the exam's jurisdiction, by submitting claims based on inaccurate information. Another incorrect approach is to refuse to query the physician and simply code based on the existing, insufficient documentation. While this avoids directly falsifying information, it fails to advocate for accurate coding and may result in underreporting of the patient's true condition, potentially impacting future care coordination and accurate quality metric reporting. It also misses an opportunity to educate the provider on documentation best practices. The professional reasoning process should involve 1. Understanding the request and its potential implications. 2. Reviewing the existing medical record for supporting evidence. 3. If evidence is lacking, initiating a professional query to the provider for clarification or additional documentation. 4. If the query yields sufficient documentation, coding accordingly. 5. If the query does not yield sufficient documentation and the provider insists on a diagnosis without support, escalating the concern through appropriate channels within the healthcare organization, adhering to internal compliance policies. This systematic approach ensures ethical conduct, regulatory compliance, and accurate representation of patient care. Question 6. System analysis indicates that a patient underwent a laparoscopic cholecystectomy performed by a general surgeon and a diagnostic upper endoscopy performed by a gastroenterologist during the same operative session. The operative reports clearly delineate the distinct nature and medical necessity of each procedure. According to the CMCB regulatory framework and its associated coding guidelines, which of the following represents the most appropriate coding approach for this scenario? Option A. Code both the laparoscopic cholecystectomy and the diagnostic upper endoscopy as distinct procedures, applying appropriate modifiers as dictated by chapter-specific coding rules for multiple procedures performed during the same session. Option B. Code the laparoscopic cholecystectomy and report the upper endoscopy with a modifier indicating it was performed by a different physician, without further consideration of chapter-specific rules. Option C. Code only the laparoscopic cholecystectomy, as it is the more complex procedure, and assume the upper endoscopy is incidental. Option D. Code the laparoscopic cholecystectomy as the primary procedure and report the upper endoscopy with a modifier indicating it was a secondary procedure, without reviewing specific chapter guidelines for each. Correct answer is A. Code both the laparoscopic cholecystectomy and the diagnostic upper endoscopy as distinct procedures, applying appropriate modifiers as dictated by chapter-specific coding rules for multiple procedures performed during the same session. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a single patient encounter involves multiple distinct procedures performed by different physicians, leading to potential confusion regarding the correct application of chapter-specific coding rules, particularly those related to sequencing and reporting of co-procedures. The professional challenge lies in accurately interpreting the operative reports, understanding the distinct services rendered, and applying the appropriate coding guidelines to ensure accurate reimbursement and compliance with payer policies, all while adhering to the specific requirements of the CMCB exam's regulatory framework. Correct approach analysis. The correct approach involves meticulously reviewing each physician's operative report to identify all distinct procedures performed. Subsequently, the coder must apply the relevant chapter-specific coding rules, such as those found in the ICD-10-CM official guidelines for coding and reporting or specific CPT coding guidelines, to determine the primary procedure and any secondary or co-procedures. This requires understanding guidelines for sequencing, modifier application, and bundling rules as they pertain to the specific chapters of the code set. For example, if a general surgeon and a cardiologist both perform distinct procedures during the same surgical session, the coder must identify the primary reason for the encounter, and then code each procedure according to its respective chapter guidelines, ensuring that no procedure is inadvertently bundled or incorrectly sequenced. This meticulous, guideline-driven approach ensures accurate representation of services rendered, compliance with payer requirements, and ethical coding practices. Incorrect approaches analysis. One incorrect approach would be to assume that all procedures performed during the same operative session by different physicians are automatically co-procedures and should be coded as such without individual assessment. This fails to adhere to chapter-specific rules that may dictate primary versus secondary procedures based on medical necessity, complexity, or the primary reason for the surgical session. This can lead to underreporting or overreporting of services, violating regulatory compliance, and potentially resulting in claim denials or audits. Another incorrect approach would be to only code the procedure performed by the physician who is considered the primary surgeon, neglecting to code distinct procedures performed by other specialists. This directly violates the principle of accurately reporting all services rendered, as outlined in coding guidelines. It also fails to comply with payer policies that require reporting of all medically necessary procedures, regardless of who performed them. A third incorrect approach would be to apply modifiers without a thorough understanding of the chapter-specific rules governing their use for co-procedures. For instance, incorrectly applying a modifier to indicate a distinct procedural service when the guidelines do not support it, or failing to apply a necessary modifier when it is required by chapter-specific rules, can lead to inaccurate billing and compliance issues. This demonstrates a lack of understanding of the nuanced application of coding rules. Professional reasoning. Professionals should approach this scenario by first understanding the scope of each physician's involvement through their respective operative reports. They must then consult the relevant coding manuals and official guidelines, paying close attention to chapter-specific rules for the procedures in question. This includes understanding guidelines for sequencing, modifier usage, and the reporting of multiple procedures. A systematic review of each procedure, followed by the application of the appropriate coding rules, is paramount. If ambiguity exists, consulting with physicians or coding supervisors and referencing payer-specific policies are essential steps in ensuring accurate and compliant coding. Question 7. Analysis of a patient's medical record reveals a diagnosis of acute myocardial infarction, MI, with subsequent percutaneous coronary intervention, PCI, and placement of a drug-eluting stent. The physician's documentation also notes the presence of hypertension and hyperlipidemia, both of which are stated to be managed during the current encounter. The coder must determine the most appropriate ICD-10-CM codes for the diagnoses and CPT codes for the procedures. Which of the following approaches best ensures accurate and compliant coding? Option A. Assign only the ICD-10-CM code for acute myocardial infarction and the CPT code for PCI with stent placement, as these are the primary reasons for the encounter. Option B. Assign the ICD-10-CM code for acute myocardial infarction and the CPT code for PCI with stent placement, and query the physician for further documentation regarding the management of hypertension and hyperlipidemia, even if they appear to be managed. Option C. Assign ICD-10-CM codes for acute myocardial infarction, hypertension, and hyperlipidemia, and the CPT code for PCI with stent placement, prioritizing codes that are commonly associated with higher reimbursement for cardiovascular conditions. Option D. Assign ICD-10-CM codes for acute myocardial infarction, hypertension, and hyperlipidemia, and the appropriate CPT code for PCI with stent placement, ensuring all codes are supported by physician documentation and sequenced according to ICD-10-CM guidelines. The correct answer is D. Assign ICD-10-CM codes for acute myocardial infarction, hypertension, and hyperlipidemia, and the appropriate CPT code for PCI with stent placement, ensuring all codes are supported by physician documentation and sequenced according to ICD-10-CM guidelines. Explanation. This scenario presents a professional challenge due to the inherent complexity of accurately coding diagnoses and procedures related to the cardiovascular system, particularly when multiple comorbidities are present. The coder must possess a thorough understanding of ICD-10-CM and CPT coding guidelines, as well as payer-specific policies, to ensure appropriate reimbursement and compliance. The risk of undercoding or overcoding exists, both of which can have significant financial and legal ramifications. Careful judgment is required to interpret physician documentation, identify the principal diagnosis, and assign all relevant secondary diagnoses and procedures. The correct approach involves a meticulous review of the entire medical record, including physician notes, diagnostic test results, and operative reports. This comprehensive review allows for the identification of all documented conditions and procedures. The coder must then apply the official ICD-10-CM and CPT coding guidelines to assign the most specific and accurate codes. This includes understanding sequencing rules for principal and secondary diagnoses, as well as selecting the appropriate CPT codes for cardiovascular procedures, ensuring they are supported by documentation. Adherence to these guidelines represents best professional practice because it ensures accurate representation of the patient's condition and services rendered, which is crucial for proper reimbursement, statistical analysis, and compliance with federal regulations, such as the False Claims Act. An incorrect approach would be to solely rely on the physician's summary statement without reviewing the detailed documentation. This failure to perform a complete chart review violates the fundamental principle of coding accuracy and can lead to the assignment of incorrect codes. Specifically, it could result in missing secondary diagnoses that impact medical necessity or severity, or assigning codes that are not fully supported by the detailed clinical information, potentially leading to overpayment and subsequent audits. Another incorrect approach would be to assign codes based on assumptions or prior knowledge of similar cases without verifying the specific details in the current patient's record. This practice is ethically unsound and violates coding guidelines that mandate coding based on documented facts. It increases the risk of inaccurate coding, which can lead to fraudulent claims and penalties. A third incorrect approach would be to prioritize reimbursement over accurate coding by selecting codes that are known to yield higher payments, even if they are not the most precise representation of the patient's condition or services. This is a direct violation of ethical coding principles and federal regulations prohibiting fraudulent billing practices. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available documentation in the medical record. 2. Identify the principal diagnosis and all relevant secondary diagnoses. 3. Determine all procedures performed. 4. Consult the official ICD-10-CM and CPT coding manuals and any relevant payer guidelines. 5. Apply coding conventions and guidelines for sequencing and code selection. 6. Query the physician for clarification if documentation is ambiguous or incomplete. 7. Assign the most accurate and specific codes supported by the documentation. 8. Maintain ongoing education to stay abreast of coding updates and regulatory changes. Question 8. The efficiency study reveals that a significant portion of claim denials are related to discrepancies between prescribed medications and documented diagnoses. A physician's progress note states, patient presence with symptoms of upper respiratory infection. Prescribed amoxicillin 500 mg TID. Which of the following actions by the medical coder and biller best ensures accurate coding and compliance with CMCB guidelines regarding common medications and their uses? Option A. Query the physician to confirm the specific diagnosis for which amoxicillin was prescribed, as amoxicillin is a broad-spectrum antibiotic commonly used for various bacterial infections, including some upper respiratory infections. Option B. Code the diagnosis as upper respiratory infection and assign a code for amoxicillin without further inquiry, assuming it is appropriate for the stated diagnosis. Option C. Assign a code for a more serious bacterial infection that amoxicillin is typically used for, to ensure maximum reimbursement. Option D. Code the diagnosis as viral upper respiratory infection and assign a code for amoxicillin, as amoxicillin is sometimes prescribed empirically for viral infections. The correct answer is A. Query the physician to confirm the specific diagnosis for which amoxicillin was prescribed, as amoxicillin is a broad-spectrum antibiotic commonly used for various bacterial infections, including some upper respiratory infections. Explanation: this scenario is professionally challenging because it requires the medical coder and biller to accurately identify and document medications based on physician notes, which can sometimes be ambiguous or incomplete. The challenge lies in ensuring that the coded diagnosis and the prescribed medication align correctly for proper reimbursement and patient care. This requires a deep understanding of common medications, their therapeutic classes, and their typical uses in relation to specific diagnoses, all while adhering to the strict documentation guidelines of the CMCB exams regulatory framework. The correct approach represents best professional practice because it prioritizes accurate coding and documentation by cross-referencing the physician's notes with established medical knowledge of common medications and their uses. This ensures that the services billed are supported by the documentation and that the patient receives appropriate care. Adherence to the CMCB regulatory framework means that all coding and billing practices must be compliant with federal and state laws governing healthcare services, including accurate representation of services rendered and appropriate use of diagnostic and procedural codes. An incorrect approach that involves coding a medication without clear physician documentation or assuming the physician's intent without explicit confirmation would be a regulatory and ethical failure. This could lead to fraudulent billing if the medication was not actually prescribed, or if it was prescribed for a condition not supported by the documentation. Another incorrect approach, such as coding a medication based on a patient's verbal report without physician documentation, would also be a failure, as it bypasses the established chain of command and documentation requirements, potentially leading to errors in patient records and billing. Failing to query the physician for clarification when documentation is unclear is also a failure, as it demonstrates a lack of diligence in ensuring accuracy and compliance. Professional decision-making in similar situations requires a systematic approach. First, thoroughly review all available physician documentation. Second, identify any medications mentioned and research their common uses and therapeutic classes. Third, cross-reference the medication with the documented diagnosis to ensure a logical clinical connection. If any ambiguity exists, the professional must query the physician for clarification before proceeding with coding and billing. This iterative process ensures accuracy, compliance, and ethical practice. Question 9. The evaluation methodology shows a medical coder reviewing a patient chart with the diagnosis cholecystitis. To accurately code this condition for billing purposes, which of the following demonstrates the most effective application of medical terminology knowledge regarding roots, prefixes, and suffixes? Option A. Recognizing cholecyst as a general term for the gallbladder and assuming itis always means infection. Option B. Identifying chole as relating to bile and cyst as relating to a sac or bladder, and itis as inflammation, leading to the understanding of gallbladder inflammation. Option C. Translating cholecystitis as a general inflammation of the digestive system due to the presence of bile. Option D. Focusing on cyst as a general term for a sac and itis as inflammation, without considering the chole prefix. The correct answer is B. Identifying chole as relating to bile and cyst as relating to a sac or bladder, and itis as inflammation, leading to the understanding of gallbladder inflammation. Explanation. The evaluation methodology shows that a medical coder is presented with a patient record containing a diagnosis of myocardial infarction. The challenge lies in accurately translating this medical term into appropriate ICD-10-CM codes for billing and statistical purposes. This requires a thorough understanding of medical terminology, specifically the root word, prefixes, and suffixes, to discern the precise meaning and location of the condition. Misinterpreting these components can lead to incorrect coding, impacting reimbursement, patient care data, and potentially violating payer regulations regarding accurate claim submission. The correct approach involves breaking down myocardial infarction into its constituent parts: myo, muscle, card, heart, and il, pertaining to, combined with infarction, tissue death due to lack of blood supply. This understanding directly leads to identifying the condition as a heart muscle tissue death, which is the definition of a heart attack. This detailed analysis ensures the coder can select the most specific and accurate ICD-10-CM code, aligning with the Centers for Medicare and Medicaid Services (CMS) guidelines for accurate and complete medical record documentation and coding. This adherence to specificity is paramount for compliance with federal healthcare regulations. An incorrect approach would be to simply recognize cardiac and assume it relates to the heart without fully understanding the myo prefix and the il suffix, potentially leading to a less specific code. Another incorrect approach would be to focus solely on infarction and miss the critical context of myocardial, which specifies the affected tissue. A third incorrect approach might involve guessing the meaning based on common medical terms without a systematic breakdown of the word's components, which is a direct violation of professional coding standards and could lead to fraudulent billing practices if the code does not accurately reflect the documented diagnosis. These failures undermine the integrity of the healthcare billing system and violate ethical obligations to report accurately. Professional reasoning in such situations requires a systematic approach. First, identify the core medical term. Second, dissect it into its root, prefixes, and suffixes. Third, determine the precise meaning of each component. Fourth, synthesize this understanding to grasp the overall diagnosis. And finally, consult the ICD-10-CM coding manual and official guidelines to select the most accurate and specific code that reflects the documented condition. This methodical process ensures compliance with regulatory requirements and upholds professional integrity. Question 10. Research into the coding implications of a physician prescribing a new medication for a patient's condition, where the drug has both a brand name and a generic name and falls into a specific therapeutic class. The medical coder and biller must determine the most appropriate classification for accurate billing and reporting within the CMCB regulatory framework. Option A. Classify the drug based on the patient's diagnosis alone, without specific reference to the drug's pharmacological properties. Option B. Classify the drug using only its brand name, assuming it is universally recognized for its intended purpose. Option C. Classify the drug based on its generic name and its primary therapeutic action as defined in the official drug compendia recognized by CMCB. Option D. Classify the drug into a broad therapeutic category that encompasses similar medications, even if a more specific category exists. The correct answer is C. Classify the drug based on its generic name and its primary therapeutic action as defined in the official drug compendia recognized by CMCB. Explanation. This scenario is professionally challenging because accurate drug classification is fundamental to correct medical coding, reimbursement, and patient safety. Misclassification can lead to incorrect billing, potential fraud allegations, and adverse patient outcomes if medication management relies on flawed data. The medical coder and biller must possess a nuanced understanding of drug nomenclature, therapeutic classes, and the specific coding systems mandated by the CMCB jurisdiction. The correct approach represents best professional practice because it demonstrates adherence to the established coding guidelines and regulatory requirements within the CMCB jurisdiction. This involves meticulously reviewing the physician's documentation, cross-referencing drug names with authoritative drug compendia and coding manuals, such as those referenced by CMCB for drug classification, and applying the most specific and accurate classification available. This ensures compliance, accurate data for healthcare analytics, and appropriate reimbursement. An incorrect approach that relies solely on the brand name of a drug without verifying its generic name and therapeutic class is a significant regulatory and ethical failure. This can lead to miscoding if the brand name is associated with multiple generic drugs or if the brand name itself is not recognized by the coding system. Another incorrect approach, using a broad or general drug classification when a more specific one is available, violates the principle of coding specificity, which is a cornerstone of accurate billing and data integrity. This can result in under- or over-reimbursement and inaccurate statistical reporting. Failing to consult official coding resources or CMCB-specific guidelines when encountering an unfamiliar drug is a critical ethical lapse, as it bypasses the established protocols for ensuring coding accuracy and compliance. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the patient's record and the physician's intent. Second, identify the drug in question and its dosage and route of administration. Third, consult the most current and authoritative drug compendia and coding manuals relevant to the CMCB jurisdiction. Fourth, determine the most specific and accurate therapeutic classification based on these resources. Finally, apply the appropriate code, ensuring it aligns with all relevant coding guidelines and payer requirements. If ambiguity exists, seeking clarification from the physician or a coding supervisor is paramount. Question 11. Process analysis reveals that a patient presents with both acute exacerbation of chronic obstructive pulmonary disease, COPD, and a newly diagnosed pneumonia. The physician's documentation clearly describes the symptoms and treatment for both conditions, but does not explicitly state which condition was the primary reason for the admission. The coder must determine the correct ICD-10-CM code sequence. Which of the following approaches best adheres to the ICD-10-CM official guidelines for coding and reporting? Option A. Sequence the code for the condition that occasioned the admission as the principal diagnosis and the other condition as a secondary diagnosis, based on the physician's documentation and the ICD-10-CM official guidelines for coding and reporting. Option B. Sequence both codes without regard to order, as both are documented and treated concurrently. Option C. Sequence the code for COPD exacerbation first, as it is a chronic condition that predisposes the patient to other issues, followed by the code for pneumonia. Option D. Sequence the code for pneumonia first, as it is a more acute condition, followed by the code for COPD exacerbation. The correct answer is D. Sequence the code for pneumonia first, as it is a more acute condition, followed by the code for COPD exacerbation. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, accurately assigning ICD-10-CM codes when a patient has multiple related conditions. The professional challenge lies in understanding the hierarchical relationships between diagnoses and applying the correct sequencing and specificity rules as dictated by ICD-10-CM official guidelines for coding and reporting. Failure to do so can lead to inaccurate claims, improper reimbursement, and potential compliance issues. The need for careful judgment arises from the nuanced interpretation of guideline instructions and the specific clinical documentation provided. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record to identify all documented diagnoses. Subsequently, the coder must consult the ICD-10-CM alphabetic index and tabular list to locate the most specific codes for each condition. Crucially, the coder must then apply the ICD-10-CM official guidelines for coding and reporting, specifically focusing on guidelines related to sequencing of diagnoses and the concept of principal diagnosis versus other diagnoses. In this case, the guideline for coding conditions that are not related to each other but are treated concurrently would be paramount. The guideline stating that when a patient is admitted for a condition that is not the principal diagnosis, the principal diagnosis should be sequenced first, followed by the condition that occasioned the admission, is key. This ensures that the primary reason for the encounter is accurately reflected, which is essential for statistical reporting and appropriate reimbursement. Incorrect approaches analysis. Coding based solely on the order in which diagnoses appear in the physician's notes without considering the guidelines for sequencing is a regulatory failure. This approach ignores the established hierarchy and logic of ICD-10-CM coding, potentially misrepresenting the patient's primary medical issue. Assigning codes for each condition without verifying if one condition is integral to or a manifestation of another, or if one condition is the primary reason for admission, is another regulatory failure. This can lead to overcoding or undercoding, impacting data accuracy and financial outcomes. Selecting a code that is less specific than what is documented in the medical record, even if it is for a condition that appears to be the primary reason for the visit, is a failure to adhere to the principle of coding to the highest level of specificity. This compromises the quality of data collected and can lead to reimbursement issues. Professional reasoning. Professionals should approach this situation by first understanding the core principle of accurate medical coding, reflecting the patient's condition as documented and as intended by the healthcare provider. This involves a systematic process. 1. Thoroughly review all available clinical documentation. 2. Identify all distinct diagnoses and their relationship to each other. 3. Utilize the ICD-10-CM alphabetic index and tabular list to find the most specific codes. 4. Critically apply the ICD-10-CM official guidelines for coding and reporting, paying close attention to sequencing rules, principal diagnosis definitions, and guidelines for coexisting conditions. 5. If ambiguity exists, query the physician for clarification on the principal diagnosis or the relationship between conditions. 6. Maintain ongoing education on coding updates and guideline revisions. Question 12. Risk assessment procedures indicate that a medical coder and biller is reviewing a new patient encounter, Which of the following initial steps is most critical for ensuring a smooth and compliant healthcare reimbursement process according to U.S. regulatory frameworks? Option A. Verifying the patient's insurance eligibility and collecting accurate demographic and insurance information at the point of registration. Option B. Immediately assigning ICD-10-CM and CPT codes based on the physician's notes without confirming payer coverage. Option C. Prioritizing the coding of services over the administrative tasks of patient registration and insurance verification. Option D. Assuming that all services documented will be covered by the patient's insurance plan without any further investigation. The correct answer is A. Verifying the patient's insurance eligibility and collecting accurate demographic and insurance information at the point of registration. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder and biller to navigate the complex and often evolving landscape of healthcare reimbursement, specifically concerning the initial stages of patient registration and its direct impact on subsequent billing accuracy. Errors at this foundational step can lead to claim denials, delayed payments, and potential compliance issues, necessitating meticulous attention to detail and a thorough understanding of payer requirements. Correct approach analysis. The correct approach emphasizes the critical role of accurate patient registration in the healthcare reimbursement process. This aligns with regulatory frameworks that mandate precise identification of patients and their insurance information to ensure proper billing and prevent fraud. By verifying insurance eligibility and collecting accurate demographic data upfront, the medical coder and biller establishes a solid foundation for a clean claim, minimizing the likelihood of denials and ensuring timely reimbursement, which is a core ethical and professional responsibility. This proactive measure directly supports compliance with payer policies and government regulations governing billing and claims submission. Incorrect approaches analysis. One incorrect approach involves prioritizing the coding of services before verifying insurance eligibility. This is a significant regulatory and ethical failure because it bypasses a crucial step in the reimbursement cycle. Without confirmed eligibility, the provider risks rendering services that may not be covered by the patient's insurance, leading to uncompensated care or the need to pursue the patient for payment, which can be a source of patient dissatisfaction and potential disputes. It also increases the administrative burden and cost of claim resolution. Another incorrect approach is to assume that all services rendered will be automatically covered by insurance without further verification. This demonstrates a lack of due diligence and a failure to adhere to payer contracts and guidelines. Insurance policies have specific coverage limitations, exclusions, and prior authorization requirements. Ignoring these can lead to claim rejections and denials, impacting revenue cycle management and potentially violating payer agreements. A third incorrect approach is to focus solely on the clinical documentation for coding, without considering the administrative aspects of the patient encounter. While accurate clinical documentation is paramount for coding, the reimbursement process is a holistic system. Neglecting the administrative prerequisites, such as accurate patient identification and insurance details, creates a disconnect that undermines the entire billing process. This can lead to claims being submitted with incorrect patient identifiers or insurance information, resulting in denials and delays. Professional reasoning. Professionals in this role should adopt a systematic approach to the reimbursement process. This begins with a thorough understanding of the patient's insurance coverage and eligibility before any services are rendered or coded. This involves verifying benefits, understanding co-pays, deductibles, and any pre-authorization requirements. Following this, accurate and complete clinical documentation must be reviewed to assign the appropriate diagnostic and procedural codes. Finally, all collected information must be accurately entered into the billing system to generate a clean claim that adheres to all payer and regulatory requirements. This structured approach ensures efficiency, accuracy, and compliance, safeguarding both the provider's financial health and the patient's experience. Question 13. Which approach would be most effective in ensuring accurate and compliant medical billing for a complex patient encounter, adhering strictly to U.S. regulatory frameworks for medical coders and billers? Option A. Assigning codes that appear to offer higher reimbursement rates, assuming the physician's intent was to bill for the most comprehensive services. Option B. Submitting claims based on the physician's initial diagnosis without cross-referencing supporting documentation or current coding manuals. Option C. Reviewing the patient's complete medical record, applying current ICD-10-CM and CPT codes based on documentation, and verifying against payer-specific guidelines and NCCI edits. Option D. Relying on historical billing patterns and commonly used codes for similar encounters, without consulting updated coding resources or payer policies. Correct answer is C. Reviewing the patient's complete medical record, applying current ICD-10-CM and CPT codes based on documentation, and verifying against payer-specific guidelines and NCCI edits. Explanation. Scenario analysis. This scenario presents a common challenge for medical coders and billers, ensuring accurate and compliant claim submission while navigating evolving payer policies and regulatory requirements. The challenge lies in balancing the need for timely reimbursement with the imperative to adhere strictly to established coding guidelines and payer-specific rules. Misinterpreting or failing to apply these guidelines can lead to claim denials, audits, and potential financial penalties, impacting both the provider and the patient. Professional judgment is required to interpret complex documentation, select the most appropriate codes, and understand the nuances of billing regulations. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record, including physician documentation, operative reports, and any supporting diagnostic results. This review must be followed by the application of the most current and appropriate ICD-10-CM and CPT codes, ensuring they accurately reflect the services rendered and the patient's condition. Crucially, this process must also incorporate an understanding of payer-specific billing guidelines and any relevant National Correct Coding Initiative (NCCI) edits. Adherence to these established coding and billing standards, as mandated by the Centers for Medicare and Medicaid Services (CMS) and other regulatory bodies governing medical billing in the U.S., is paramount for compliant and successful claim submission. This systematic and evidence-based approach minimizes errors and maximizes the likelihood of clean claim acceptance. Incorrect approaches analysis. Submitting claims based solely on the physician's initial diagnosis without verifying supporting documentation or considering coding guidelines represents a significant regulatory and ethical failure. This approach bypasses the fundamental requirement for accurate coding based on documented services and diagnoses, increasing the risk of fraudulent or erroneous billing. Relying on past billing practices or common coding patterns without consulting current coding manuals and payer policies is also a failure. Coding guidelines and payer rules are subject to change, and outdated practices can lead to noncompliance, claim rejections, and potential recoupments. This demonstrates a lack of diligence and a failure to stay current with professional standards. Using codes that are perceived as more lucrative without sufficient documentation to support them is a direct violation of ethical and regulatory principles. This practice constitutes fraudulent billing and can result in severe penalties, including fines and exclusion from federal healthcare programs. It undermines the integrity of the billing process and patient care. Professional reasoning. Medical coders and billers must adopt a systematic, evidence-based approach to claim preparation. This involves a meticulous review of the medical record to ensure all coding decisions are supported by documentation. Professionals should prioritize staying updated on the latest coding conventions, payer policies, and regulatory changes through continuous education and access to current resources. When faced with ambiguity, seeking clarification from the physician or consulting with coding experts is essential. The ultimate goal is to ensure accurate, compliant, and ethical billing practices that support appropriate reimbursement while upholding the integrity of the healthcare system. Question 14. The review process indicates that a medical coder, when preparing a CMS 1500 claim form for a patient receiving outpatient physical therapy services, encountered a situation where the patient's insurance policy number was partially obscured on their insurance card. The coder proceeded to submit the claim with the incomplete policy number, assuming the payer could identify the patient through other demographic data. Which of the following actions best reflects the required professional and regulatory standards for claim submission? Option A. Contact the patient or their guarantor to obtain the complete insurance policy number before submitting the claim. Option B. Omit the insurance policy number field entirely, as it is not fully legible, and proceed with claim submission. Option C. Submit the claim with the incomplete policy number, relying on the payer's ability to cross-reference with other demographic information. Option D. Estimate the missing digits of the insurance policy number based on common patterns observed for that payer. The correct answer is A. Contact the patient or their guarantor to obtain the complete insurance policy number before submitting the claim. Explanation. The review process indicates a potential discrepancy in how patient demographic and insurance information was handled on a submitted claim form. This scenario is professionally challenging because it requires coders and billers to balance accuracy, compliance with payer requirements, and patient privacy. Misrepresenting or omitting key demographic or insurance details can lead to claim denials, financial repercussions for the provider, and potential violations of federal regulations like the Health Insurance Portability and Accountability Act, HIPAA. Careful judgment is required to ensure all information is accurate and complete without compromising patient confidentiality. The correct approach represents best professional practice because it prioritizes accurate data entry and adherence to payer-specific guidelines for claim submission. The CMS 1500 and UB04 forms have specific fields for patient demographics and insurance information that must be completed precisely as provided by the patient or their guarantor. This ensures the claim can be properly processed by the payer, minimizing delays and denials. Adhering to these requirements is fundamental to compliant billing and directly impacts the revenue cycle. An incorrect approach that involves guessing or inferring patient demographic information is professionally unacceptable. This violates the principle of accurate data representation on billing forms. Federal regulations, such as those governing Medicare and Medicaid, mandate truthful and accurate reporting of information. Furthermore, making assumptions about insurance coverage or patient identity could lead to billing the wrong payer, which is a form of fraud and abuse. Another incorrect approach, such as omitting insurance information when it is known but not readily available at the time of submission, is also professionally unacceptable. While the intent might be to expedite submission, it ultimately hinders proper claim adjudication. Payers require complete insurance details to process claims correctly. Failing to provide this information, even if temporarily, can lead to claim rejections and delays, impacting the provider's cash flow and potentially violating payer contracts. The professional reasoning framework for such situations involves a systematic approach. 1. Verify all patient demographic and insurance information against source documents e.g. patient registration forms, insurance cards. 2. Understand the specific requirements of the payer for each field on the relevant claim form, CMS 1500 for professional services, UB04 for institutional services. 3. If information is missing or unclear, follow established protocols for obtaining clarification from the patient, guarantor, or internal departments before submitting the claim. 4. Prioritize accuracy and completeness over speed when dealing with critical claim data. 5. Be aware of and adhere to all relevant federal and state regulations, including HIPAA, regarding patient information and billing practices. Question 15. The analysis reveals that a medical coder is under pressure from management to submit claims as quickly as possible to improve cash flow. The coder encounters a patient encounter where the physician's documentation is ambiguous regarding the complexity of the service provided. The coder is aware that a more complex code would result in higher reimbursement, but is unsure if the documentation fully supports it. Which of the following actions best represents a compliant and ethical approach for the medical coder in this situation? Option A. Submit the claim with the higher-paying code and hope that the payer does not audit the record, as the pressure to expedite is significant. Option B. Query the physician for clarification on the documentation to ensure accurate code selection before submitting the claim. Option C. Submit the claim using a lower-paying, clearly supported code to avoid any potential issues, even if it means leaving potential revenue on the table. Option D. Submit the claim using the higher-paying code, assuming the physician intended to provide a more complex service, and address any potential denials later. Correct answer is D. Submit the claim using the higher-paying code, assuming the physician intended to provide a more complex service, and address any potential denials later. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing and coding, balancing the need for accurate claim submission with the pressure to expedite payment. Coders and billers must navigate complex regulatory landscapes, such as HIPAA and the False Claims Act, which mandate truthful and accurate reporting of services. The professional challenge lies in discerning between legitimate billing practices and those that could be construed as fraudulent or abusive, even if unintentional. Misinterpreting guidelines or succumbing to pressure can lead to significant financial penalties, reputational damage, and even legal repercussions for both the individual and the healthcare organization. Correct approach analysis. The correct approach prioritizes adherence to established coding guidelines and payer policies, even if it means a slight delay in claim submission. This aligns with the core principles of compliance and ethical billing. Specifically, it upholds the integrity of the billing process by ensuring that all documentation supports the codes submitted, thereby preventing potential accusations of upcoding or billing for services not rendered. This approach is justified by regulations like the False Claims Act, which penalizes knowingly submitting false or fraudulent claims to the government, and the Anti-Kickback Statute, which prohibits offering or receiving remuneration to induce referrals for services paid by federal healthcare programs. By meticulously verifying documentation and coding, the professional acts in accordance with the CMCB ethical code, which emphasizes accuracy, integrity, and patient well-being. Incorrect approaches analysis. Submitting claims with codes that are not fully supported by the medical record, even with the intention of expediting payment, represents a failure to comply with accurate coding principles and can violate the False Claims Act. This is because it constitutes a misrepresentation of services provided. Ignoring payer-specific guidelines in favor of a quicker submission process is a direct violation of payer contracts and can lead to claim denials, recoupments, and potential audits. Payers have specific rules for reimbursement, and deviating from them is a breach of agreement and regulatory expectation. Failing to query the physician for clarification when documentation is ambiguous or incomplete is a critical ethical and regulatory lapse. This omission can lead to incorrect coding, which, if submitted, can result in fraudulent claims. It also bypasses a crucial step in ensuring the accuracy and completeness of the medical record, which is foundational to compliant billing. Professional reasoning. Professionals in this field should adopt a systematic decision-making process that begins with a thorough understanding of all relevant regulations, HIPAA, False Claims Act, Anti-Kickback Statute, etc., and payer policies. When faced with ambiguous documentation or pressure to expedite, the primary step is to consult the official coding guidelines, e.g., CPT, IC 10CM, and payer manuals. If clarity is still lacking, the next crucial step is to initiate a physician query to obtain the necessary documentation or clarification. This documented query process serves as evidence of due diligence and a commitment to accurate coding. Prioritizing compliance and accuracy over speed is paramount, as the long-term consequences of noncompliance far outweigh any short-term benefits of expedited payment. Question 16. Compliance review shows a medical coder assigned a CPT code for drug administration based on the patient's diagnosis of severe pain, without verifying the specific National Drug Code, NDC, or the documented route of administration for the prescribed analgesic. The provider's documentation indicates the administration of a specific opioid medication. What is the most appropriate course of action for the coder to ensure accurate billing and regulatory compliance? Option A. Assume the opioid is a standard injectable and assign a generic code for injectable pain medication administration, as the diagnosis of severe pain justifies the service. Option B. Reevaluate the medical record to identify the specific NDC and documented route of administration for the opioid. Then select the CPT code that accurately reflects the drug and its administration method, consulting coding guidelines as necessary. Option C. Code the administration based solely on the diagnosis of severe pain, as this is the primary driver for medical necessity and reimbursement. Option D. Assign a code for a different route of administration, such as oral if the drug is commonly available in that form, to expedite the billing process. The correct answer is B. Reevaluate the medical record to identify the specific NDC and documented route of administration for the opioid. Then select the CPT code that accurately reflects the drug and its administration method, consulting coding guidelines as necessary. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing and coding, where a coder must accurately interpret and apply drug information to ensure proper reimbursement and compliance. The challenge lies in understanding the nuances of drug classification, administration routes, and their impact on coding, especially when dealing with multiple drugs or complex formulations. Misinterpretation can lead to claim denials, overpayments, or underpayments, all of which have significant financial and regulatory implications. Correct approach analysis. The correct approach involves meticulously referencing the National Drug Code, NDC, and the drug's prescribing information to determine the most appropriate CPT code for the administration of the medication. This aligns with the principles of accurate medical coding, which requires precise documentation and adherence to established coding guidelines. By verifying the NDC and understanding the drug's properties, the coder ensures that the code selected reflects the actual service provided, minimizing the risk of billing errors and regulatory non-compliance. This practice upholds the integrity of the billing process and supports accurate data reporting for healthcare services. Incorrect approaches analysis. One incorrect approach is to assume the drug is a common over-the-counter OC medication and assign a generic administration code without verifying its specific classification or the provider's intent. This fails to account for potential prescription status, specific therapeutic classes, or unique administration requirements that might necessitate a different code. It violates the principle of accurate coding by not confirming the drug's details, potentially leading to incorrect billing and non-compliance with payer policies that may differentiate between OTC and prescription drugs for reimbursement. Another incorrect approach is to code based solely on the patient's diagnosis, without considering the specific drug administered. While the diagnosis is crucial for medical necessity, it does not dictate the administration code for a drug. This approach ignores the pharmacological basics and the specific service rendered, leading to inaccurate coding and potential fraud or abuse allegations if the coding does not reflect the actual treatment provided. It bypasses the fundamental requirement of linking the service, drug administration, to the correct code. A third incorrect approach is to use a code for a different route of administration than what was documented. For example, coding for an intravenous infusion when the drug was administered intramuscularly. This is a direct violation of coding guidelines, which mandate that the code must accurately reflect the service performed. Such an error can lead to claim denials, recoupments, and penalties for misrepresenting services rendered, undermining the accuracy and trustworthiness of the billing process. Professional reasoning. Professionals should approach this situation by prioritizing accurate documentation and adherence to coding guidelines. The decision-making process should involve 1. Thoroughly reviewing the medical record for all relevant details, including the drug name, NDC, dosage, and route of administration. 2. Consulting authoritative coding resources, such as CPT manuals and payer-specific guidelines, to identify the most appropriate code. 3. Verifying drug information through reliable sources if documentation is unclear. 4. Understanding the pharmacological basics of the drug to ensure correct classification and coding. 5. Maintaining ongoing education on drug coding and relevant regulations to ensure compliance. Question 17. Operational review demonstrates that a significant number of claims submitted for a particular service are missing the required prior authorization number. What is the most appropriate course of action for the medical billing department to ensure compliance and efficient reimbursement? Option A. Manually enter a placeholder or estimated prior authorization number to expedite submission. Option B. Submit the claims as is, with the understanding that the prior authorization number may be requested later. Option C. Contact the physician's office or patient to obtain the correct prior authorization number and resubmit the claim with the updated information. Option D. Advise the clinical staff to cease providing the service until a more robust system for tracking prior authorizations is implemented. The correct answer is C. Contact the physician's office or patient to obtain the correct prior authorization number and resubmit the claim with the updated information. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing where a critical piece of information, the prior authorization number, is missing from a claim. This omission can lead to claim denial, delayed reimbursement, and potential financial strain on the healthcare provider. The professional challenge lies in determining the most effective and compliant method to rectify the error without compromising the integrity of the claims submission process or violating payer regulations. Correct approach analysis. The correct approach involves proactively identifying the missing information, contacting the appropriate party, e.g., the physician's office or the patient, to obtain the prior authorization number, and then resubmitting the claim with the corrected information. This aligns with the principles of accurate claims submission as mandated by payers and regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, in the U.S. Promptly correcting errors and resubmitting ensures that the claim is processed efficiently, minimizes the risk of denial, and upholds the provider's commitment to accurate billing practices. This proactive approach demonstrates due diligence and adherence to payer requirements for complete and accurate claim data. Incorrect approaches analysis. Submitting the claim without the prior authorization number, hoping it will be overlooked, is a direct violation of payer policies and potentially fraudulent. Payers require this information for covered services, and its absence will almost certainly result in denial, leading to increased administrative burden and lost revenue. This approach demonstrates a lack of professional integrity and a disregard for regulatory compliance. Attempting to manually add a fabricated prior authorization number is unethical and fraudulent. This constitutes misrepresentation of information to the payer, which can lead to severe penalties, including fines, exclusion from federal healthcare programs, and potential legal action. It undermines the trust between providers and payers. Ignoring the missing prior authorization number and writing off the service as a loss is financially irresponsible and unprofessional. While it avoids immediate claim submission issues, it results in uncompensated care and negatively impacts the provider's revenue cycle. It also fails to address the underlying issue of incomplete documentation, which could lead to future submission problems. Professional reasoning. Professionals should adopt a systematic approach to claim submission that includes pre-submission checks for completeness and accuracy. When errors are identified, the decision-making process should prioritize prompt and compliant resolution. This involves understanding payer requirements, utilizing available resources to obtain missing information, and adhering to established protocols for claim correction and resubmission. A commitment to accuracy, integrity, and regulatory compliance should guide all actions in the claim submission process. Question 18. During the evaluation of a patient's medical record, the physician documents acute exacerbation of chronic obstructive pulmonary disease, COPD, with pneumonia. The physician also notes a history of hypertension, well controlled. The coder must determine the principal diagnosis and appropriate secondary diagnosis. Which of the following coding approaches best reflects accurate and compliant practice according to ICD-10-CM guidelines? Option A. Code J44. 1. Chronic obstructive pulmonary disease with acute exacerbation as the principal diagnosis and only code J18. 9. Pneumonia unspecified organism, omitting the hypertension due to it being a history. Option B. Code J18. 9. Pneumonia unspecified organism as the principal diagnosis, followed by J44. 1. Chronic obstructive pulmonary disease with acute exacerbation, and then code a more specific pneumonia code if available, even if not explicitly documented as the primary reason for admission. Option C. Code J44. Chronic obstructive pulmonary disease with acute exacerbation as the principal diagnosis, followed by J18. 9. Pneumonia unspecified organism and I-10 essential primary hypertension. Option D. Code J18. 9. Pneumonia unspecified organism as the principal diagnosis, followed by J44. 1. Chronic obstructive pulmonary disease with acute exacerbation, and I-10 essential primary hypertension. The correct answer is C. Code J44. 1. Chronic obstructive pulmonary disease with acute exacerbation as the principal diagnosis, followed by J18. 9. Pneumonia unspecified organism, and I-10 essential primary hypertension. Explanation. This scenario is professionally challenging because it requires the medical coder to accurately identify and apply ICD-10-CM codes for a complex patient presentation involving multiple, potentially overlapping, conditions. The challenge lies in discerning the principal diagnosis and sequencing secondary diagnoses appropriately, which directly impacts reimbursement and quality reporting. Careful judgment is required to ensure compliance with coding guidelines and payer policies, avoiding both undercoding and overcoding. The correct approach represents best professional practice because it adheres strictly to the ICD-10-CM official guidelines for coding and reporting. This involves a thorough review of the medical record to identify all documented conditions, understanding the cause and effect relationships between diagnoses, and applying the sequencing rules to determine the principal diagnosis. This ensures accurate representation of the patient's encounter, supports appropriate medical necessity, and aligns with payer requirements for claims submission. An incorrect approach that focuses solely on the most severe symptom without considering the underlying cause fails to capture the full clinical picture and violates the principle of coding to the highest degree of specificity. This can lead to inaccurate data for public health reporting and potentially impact quality metrics. Another incorrect approach that assigns codes for conditions not clearly documented or supported by the physician's assessment is unethical and fraudulent. This misrepresents the patient's condition and can lead to claim denials or audits. A third incorrect approach that prioritizes codes that might lead to higher reimbursement without clinical justification is a direct violation of ethical coding standards and can be considered fraudulent. This undermines the integrity of the healthcare system. Professionals should employ a systematic decision-making process. 1. Thoroughly review the entire medical record, including physician documentation, operative reports, and diagnostic test results. 2. Identify all documented diagnoses and conditions. 3. Consult the ICD-10-CM alphabetic index and tabular list to find the most specific codes. 4. Apply the ICD-10-CM official guidelines for coding and reporting, paying close attention to sequencing rules, principal diagnosis determination, and guidelines for coding multiple conditions. 5. Query the physician for clarification if documentation is ambiguous or incomplete. 6. Ensure codes accurately reflect the patient's condition and the services provided, aligning with payer policies. Question 19. Benchmark analysis indicates that a medical coder is reviewing a patient encounter where the physician's progress note mentions suspected pneumonia, but lacks definitive diagnostic confirmation or specific details about the type of pneumonia. The operative report for a related procedure is also available, but does not offer further clarification on the pneumonia diagnosis. What is the most appropriate course of action for the medical coder to ensure accurate and compliant coding? Option A. Assign a less specific code for a respiratory infection, as pneumonia is only suspected. Option B. Query the physician for clarification on the diagnosis of pneumonia and any supporting details. Option C. Hold the claim indefinitely until further documentation is provided by the physician. Option D. Code for pneumonia based on the physician's suspicion, assuming it is the most likely diagnosis. The correct answer is B. Query the physician for clarification on the diagnosis of pneumonia and any supporting details. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder to interpret and apply complex coding guidelines to a patient encounter where documentation is incomplete. The challenge lies in balancing the need for accurate coding to ensure proper reimbursement and compliance with payer requirements against the ethical obligation to code only what is documented. Misinterpreting the documentation or making assumptions can lead to significant compliance issues, including fraud and abuse allegations, and can negatively impact the healthcare provider's revenue cycle. The coder must exercise critical judgment to determine the most appropriate code based on the available information, while adhering strictly to established coding standards. Correct approach analysis. The correct approach involves thoroughly reviewing all available clinical documentation, including physician notes, operative reports, and pathology reports, to identify any supporting evidence for the suspected diagnosis or procedure. If the documentation is insufficient to assign a specific code, the coder should query the physician for clarification. This approach represents best professional practice because it aligns with the official coding guidelines, which mandate that coders code to the highest level of specificity supported by the documentation. Querying the physician is a crucial step in obtaining the necessary information to assign accurate codes, thereby ensuring compliance with payer policies and regulatory requirements such as those enforced by the Centers for Medicare and Medicaid Services, CMS, and the Health Insurance Portability and Accountability Act, HIPAA. This process upholds the integrity of medical records and billing. Incorrect approaches analysis. Assigning a code based on a suspected diagnosis without explicit documentation or physician confirmation is a significant regulatory and ethical failure. This practice violates the principle of coding based on documented facts and can lead to inaccurate billing, potentially resulting in overpayments or underpayments, and is considered fraudulent. It also breaches the coder's responsibility to maintain accurate and truthful records. Coding the encounter with a less specific code than is supported by the available documentation, even if it is documented, is also an ethical and regulatory failure. While not as severe as upcoding, it can lead to underpayment and misrepresentation of the patient's condition or the services rendered, impacting quality metrics and research data. It fails to capture the full scope of care provided. Choosing to leave the encounter uncoded indefinitely due to minor documentation gaps without attempting to resolve them through a physician query is also professionally unacceptable. This can lead to delayed or denied claims, negatively impacting the healthcare provider's revenue cycle and potentially violating payer contract terms regarding timely filing. It demonstrates a lack of proactive problem-solving and adherence to efficient billing processes. Professional reasoning. Professionals in this field must adopt a systematic approach to coding. This involves 1. Thoroughly reviewing all available documentation. 2. Identifying any ambiguities or missing information. 3. Consulting the official coding guidelines and relevant payer policies. 4. If documentation is insufficient, initiating a physician query to obtain necessary clarification. 5. Assigning codes only when supported by documented evidence. 6. Understanding the implications of accurate coding for patient care, financial reimbursement, and regulatory compliance. This structured decision-making process ensures that coding is both accurate and compliant, minimizing risk and maximizing the integrity of the billing process. Question 20. Quality control measures reveal that a medical practice is consistently submitting claims that reflect a high volume of individual procedures, even though recent payer contracts have shifted towards a value-based care model that rewards quality outcomes and patient satisfaction. The coding and billing team is struggling to adapt their processes, with some advocating for continued aggressive billing of all services rendered, while others suggest a more conservative approach focused on essential services only. Which of the following approaches best aligns with the principles of value-based care and ensures appropriate reimbursement while maintaining compliance? Option A. Developing a comprehensive understanding of the value-based care contract, including its specific quality metrics, patient outcome targets, and bundled payment arrangements, and aligning coding and billing practices to accurately reflect the achievement of these goals and the overall value delivered to the patient. Option B. Continuing to bill under the traditional fee-for-service model as much as possible, as this is the most familiar and predictable method for revenue generation, and only making minor adjustments to accommodate the value-based care requirements. Option C. Implementing coding and billing strategies that prioritize accurate documentation of all services provided, ensuring that each service is coded to maximize reimbursement under the fee-for-service component of the contract, while also tracking quality metrics for reporting purposes. Option D. Shifting focus to coding and billing practices that emphasize the efficient delivery of care, ensuring that only the most critical services are billed, and actively seeking opportunities to reduce the overall number of procedures performed. The correct answer is C. Implementing coding and billing strategies that prioritize accurate documentation of all services provided, ensuring that each service is coded to maximize reimbursement under the fee-for-service component of the contract, while also tracking quality metrics for reporting purposes. Explanation. This scenario presents a common challenge in medical billing and coding, ensuring accurate reimbursement in a healthcare system transitioning from traditional fee-for-service models to value-based care initiatives. The professional challenge lies in understanding and correctly applying the distinct reimbursement methodologies and their underlying principles, which directly impacts revenue cycle management and compliance. Careful judgment is required to differentiate between the two models and apply the appropriate coding and billing strategies. Correct approach represents best professional practice because it demonstrates a thorough understanding of the shift towards value-based care, which emphasizes patient outcomes and quality of care over the volume of services. This approach aligns with the evolving regulatory landscape and payer expectations, promoting efficient and effective healthcare delivery. By focusing on the specific requirements of value-based contracts, such as quality metrics and patient engagement, the coder ensures that the practice is positioned to succeed under these new payment models, thereby maximizing legitimate reimbursement and avoiding compliance issues. This proactive stance is crucial for financial stability and for contributing to the broader goals of healthcare reform. An incorrect approach that focuses solely on maximizing billable services under a fee-for-service mindset fails to acknowledge the fundamental principles of value-based care. This can lead to overutilization of services, which is not only financially unsustainable, but also ethically questionable and potentially non-compliant with value-based agreements. Such an approach may result in claim denials, penalties, and damage to the provider's reputation. Another incorrect approach that misinterprets value-based care as simply reducing services without regard for patient outcomes is also professionally unacceptable. Value-based care requires a strategic shift in care delivery to achieve better outcomes more efficiently, not a blanket reduction in necessary services. This could lead to compromised patient care, negative quality scores, and ultimately, financial penalties under value-based contracts. The professional decision-making process for similar situations should involve a clear understanding of the payer contract and the reimbursement model in place. Coders and billers must actively seek education on different payment methodologies, particularly the nuances of value-based care. This includes understanding how quality metrics, patient satisfaction, and outcome data influence reimbursement. When faced with ambiguity, consulting with practice management, compliance officers, or payer representatives is essential. A systematic review of payer contracts and a commitment to continuous learning are paramount to navigating the complexities of modern healthcare reimbursement and ensuring ethical and compliant billing practices.